Right now we have the opportunity to speak with Dr. Phil Bondurant from Summit County Health Department. Dr. Bondurant, thanks for joining us on the show today.
Thanks for having me. Good morning.
So I'm curious to know how things are going right here in Summit County as relates to COVID-19.
Right now, we find ourselves in a really good spot. Our daily case count continues to be low, averaging between 3 to 4 cases a day. The number of recovered far exceeds the number of active cases, which is always something that we're focused on. Um, we've seen a really good response in regards to the face mask order and what that has been able to do and help us accomplish over the last few months. So right now we're really, all of the data indicate that we're in a favorable spot, and we're really in good conditions right now moving forward given the brevity of the situation.
Which is really great news, but as schools open and activities start, such as sports activities, games, events, they're starting in a safe way, but even though things are getting better, we still need to be very careful.
Yeah, absolutely. We've been in very close contact with the school superintendents, the school athletic directors, school staff, school nurses. I mean, everybody that could be involved in this conversation has been a part of it. And we are waiting to see what happens. We've done everything we can. The school districts are doing everything they can to try and make openings as safe as possible by reducing risk and implementing certain activities and precautions throughout the school day that minimize that risk. But again, um, it's kind of a wait and see what happens sort of deal. We know that Washington County down in St. George area is opening school today. They're the first of the school districts to open in the state, so we'll be keeping a close eye on that and see what happens down there. But it's really important to understand that the mask ordinance is in place to help things like a fall sports season take place, and everybody, parents, spectators, family, friends, brother, sister, other athletes, it's important that we take into consideration the different things we can do to make sure that we can have a sports season, but also that school is safe as possible, and reduce the potential risk of increased disease transmission as we start back to school.
And research definitely points to the fact that masks are helping, correct?
Yes, there's been a study that came out earlier this week that has gained quite a bit of traction on social media and through the news, where I believe it was Duke University did a study that was set up to identify the different masks that are available to individuals and how they work, and the data is fairly firm that these are that masks do have a positive effect, and there are different degrees in which masks uh, don't protect, but protect others and limit the spread of aerosolized droplets and aerosolized particles in the community. So yeah, masks definitely have a benefit, and one of the reasons that we've had such good success with our face covering order here in Summit County.
And this has been a daily reality for you and everyone at Summit County Health Department. You've gone from the first case to an increase in cases, different waves. How do you feel about where we are right now and as we head into the winter season?
Right now, if there was one thing that I could leave the audience with, it's that we are really proud of this community. We've had those that have bought into what it is that we are trying to accomplish, and we have those that are still a little bit hesitant to dive in, I guess you could say, and adopt some of these ideals or concepts or um, things that we've put in place to help slow the spread of COVID. But generally speaking, the community has been awesome. We see a higher compliance of masks, lots of support from the community here, and as a result, we find ourselves in a really good position. You think about what happened at the beginning of March and where we were at, the first in the state for many things regarded to or related to COVID, and where we are now. We've seen a few spikes and valleys and different things that have definitely tested our resources and tested our manpower. But right now, we find ourselves in a really good position, and that's one of the questions that has been asked: is Are we in a position where we can open school? And nobody really has the answer to that. If we did, everybody across the United States would be doing the exact same thing. But the variation that you see, even in the state of Utah, with the opening of schools, still leads us to believe that we're still trying to figure out what's best for our communities. If we were to look at where we stand now, with our data, with our cases, with the different things, parameters that we've been looking at, um, we are in a good position to open schools and to try to do so safely. That doesn't mean that because our case counts are low that the risk of transmission is non-existent, because there's still a risk there. But the situation that we find ourselves in now, it might not get any better until we have vaccines available to us. So that being said, uh, the superintendents, the health department, everybody involved have had very um, long discussions about where we're at, and we believe that if schools are going to open, now is the time to do it, given our caseload, where we're at, and then of course keep very close eye on it in working with all these partners to see how things shape up over the next few weeks.
It is good news, but still a long way to go. Dr. Phil Bondurant, thank you so much for joining us on the show today. We very much appreciate your time. And it's good to hear that the numbers are looking good, but we still need to wear our masks, socially distant, wash our hands, and do all of those things to keep our community safe. So again, Dr. Bondurant, thanks for joining us.
Thank you for having me.
All right, we'll be back with more on this Health and Wellness Thursday. Don't go anywhere.